Now you're ready to begin primary assessment. Let's look at primary assessment. First, a responsive patient is one who is alert and able to answer questions. Begin with assessing the scene. Stop, think, then act. Next, give the responder statement. Hello, my name is, your name. I'm an emergency responder. May I help you? Because responsive patients are talking or making noises other than gasping, you've verified that their airway is open and they are breathing normally, the first two steps in the cycle of care. This patient is responsive and is breathing normally, allowing you to skip over the cab portion of the cycle of care. Keep the patient still. Do not move the patient unless you or the patient's safety is compromised. Put on barriers if immediately at hand. Next, check for serious bleeding, shock, and spinal injury. Now let's look at the primary assessment with an unresponsive patient. Begin again by assessing the scene. Stop, think, and then act. Next, give the responder statement. Hello, my name is, your name. I'm an emergency responder. May I help you? This patient doesn't respond to your statement, so tap him on the collarbone to further check responsiveness. While tapping the patient, ask, "Are you okay? Are you okay?" After delivering the responder statement, quickly check for an open airway and normal breathing, using the head tilt chin lift. To perform a head tilt chin lift, first place your hand on his forehead. Next, place your fingertips under the point of his chin, like this. Finally, gently tilt his head back and lift his chin. When the patient's airway is open, check for normal breathing. To do this, look for chest movement and listen for breathing sounds. Also, with your ear next to his mouth, feel for expired air on your cheek. This check for normal breathing must be accomplished quickly. If the patient is not breathing normally, he needs CPR immediately. Avoid long delays. If the patient is not responsive or breathing normally, ask a bystander to call EMS and secure an AED if possible. If you are alone, use your mobile phone to call EMS. If you do not have a mobile phone, leave the patient to call EMS if no other option exists. This is the call first approach to emergency care. You call first to activate emergency medical service.